here is the rundown for today. Okay, after the discussion, Professor Lavorgna will deliver about a 45-minute presentation. And then we will have Professor Wei Zhan to serve as a discussant. And then Professor Liang Hai from School of Journalism, Communication, and Chinese U will join us in the section of Q&A. And now let me briefly introduce our distinguished speakers today. Professor Anita Lavorgna is associate professor in the Department of Sociology, Social Policy and Criminology at the University of Southampton. Professor Lavorgna has an international research track record and expertise in interdisciplinary research, drawing together criminology, social legal studies, and web science. She has worked extensively on cybercrime, serious and organized crime, and online social harms. The topic for today is information pollution in pandemic times, some insights from socio-technical research. The floor is yours, Professor Lavorgna. Please join me to welcome up Anita.
Thank you so much for the very kind introduction. So just let me share my screen, and you should see it very soon. So slideshow from beginning. Can you all see it?
Yes.
Okay, perfect. Thank you. So thank you again for the very kind introduction. I'm already been introduced, so I just want to add that it's a real pleasure to be here today. So information pollution in pandemic times and some insights from socio-technical research. Let's try. So let's start with a little bit of background before we go to the core of this presentation, to give a little bit of an overview of the type of approach that I adopt in looking at the pandemic. This is a talk about things that have to do with the pandemic, and also hopefully to give you a sense about why a criminologist is talking about information, which might be a little bit curious. So let's start. Well, I think we are all well aware that we are into a pandemic right now. In my work, I'm considering this as a real time of crisis, looking at how it led to an unstable and uncertain situation affecting individuals, communities, and many societies alike. It's of course not hard to imagine how this, at least temporary, socioeconomic revolution still has major effects as regards crime and deviance, challenging criminologists, but more in general social scientists to study and interpret what is an evolving context. Here in this presentation, I want to shed light on some social practices which I consider to be highly relevant also from a criminological perspective. I'm looking at misinformation, disinformation, and similar practices, and I'm conceptualizing them in the broader context of technology facilitated social harms. As we will hopefully soon see, the topics that I'm going to cover in this presentation are actually building on some previous work I carried out since 2015. But in this context, I will mainly focus on a couple of recent papers that I have a prevalent computational component. So probably a parenthesis might be needed here. I'm a qualitative researcher. I work in interdisciplinary settings, so the studies that I'm going to present here have been carried out in a very interdisciplinary way together with web scientists that have helped with the computational elements, but I mainly deal generally in with the qualitative aspects of the research, but we work very closely together in kind of iterative circles of research, trying to make the most of large data sets while trying to reduce biases as much as we can. I will cover this a little bit more in detail later, but basically from my perspective, large data sets, big data are much important, not just for a quantitative point of view, but there are also like, to say, big qualitative data sets, if you want, that I try to investigate. So, as said before entering at the core of this presentation, there are again a few premises that are really needed. So I will start with a couple of slides providing some more general introductory background that is useful to conceptualize what will follow, and as said, to explain you what type of lenses I'm using to address this topic. So let's start with something on the pollution of health-related information. So in the unfolding of the pandemic, a flurry of information has been published and widely disseminated, building up a pile of relevant knowledge alongside equivocal or deceiving news. Many words have been used globally, such as infodemic, to describe the situation. But some of this terminology, I personally don't like them because they compare the spread of bad information as a sort of virulent, uncontrolled contagion. However, as we will see, receivers of information do not simply have a passive role as the infected object of an external agent. Especially in and through cyberspace, many receivers are a productive audience. So for these reasons, I prefer to use the notion of information pollution, which is a broader umbrella term that encompasses misinformation. So when false information is shared but no harm is meant, disinformation, so when false information is knowingly shared with the intent to cause harm, but also malinformation, which is when good, genuine information is shared but with intent to cause harm, or with a potential intent to cause harm. So polluted information can be of very different types. Here, and actually this is a terminology that came out in political science to discuss about like political polluted information. Here in my work, I'm focusing on polluted information that has to deal with health, and specifically on that information that is propagating non-science-based medical mis or disinformation. This topic has been studied in the past by other social scientists. Think about topics about like anti-vax misinformation. Of course, this is not something, I mean, as just mentioned, it's something that has been studied from different perspectives by different disciplines. I'm trying to bring in a criminological perspective. Disinformation or misinformation, or more broadly polluted information when it comes to health, of course, it's not something new. It's something that has longer existed, and there is a research since the 70s dealing with quackeries and so on and so forth. However, of course, there have been major changes that are of interest nowadays, having to deal with the commercialization of cyberspace and the Web 2.0, etc., and the creation of online communities discussing also health issues, and broader changes that, at least in many countries, have impacted the relationship with GPs, doctors, etc., impacting in a way the climate of trust. So there are, let's say, broader social issues going on in the background, but here, of course, I'm just focusing on the pandemic issues. So the second premise that I need to do is, I'm talking about social harms and conceptualizing these things as social harms. So why does this matter from a criminological perspective? So criminology, of course, is about the study of crime or sometimes of deviance, so things that are against the social norms. But what about information pollution? So here we have to say that with very few exceptions, criminologists have mostly overlooked potentially dangerous and non-science-based health practices as a topic of investigation, both as regards some unquestionably illegal practices. So for instance, there are cases of frauds that might go more clearly into the remit of a criminological imagination, if you want. But also more in general, there is the potential negative impact of some of these practices on vulnerable individuals, even when they do not clearly meet a threshold of illegality. So we might have, in the case of disinformation, there can be a big impact on an individual, on this individual family, friends, the wider society, but maybe we might struggle to identify a specific crime, right? So my point is that these practices and very broadly health-related information pollution and its subset of medical misinformation, I think they are perfect candidates to be considered through the social harm lenses, which is an approach that is particularly promising when investigating events and activities that occur gray areas of legality, where there may be a misalignment between the criminal law and the presence of harmful or potentially harmful antisocial behaviors, or where some of the harms might be hidden. So basically, it's an approach that's been used in criminology, for instance, when it comes to environmental harms or other types of activities in the past, with the idea that we need to look beyond a legalistic approach to crime, sometimes even beyond a definition of deviance, because some types of information pollution, we won't have time today to linger on these aspects, but actually might be difficult for us to define them as deviant, because defining something as deviant might, how to say, give for granted the presence of a certain consensus in society, or the presence of a certain consensus within a certain community, but actually certain types of polluted information becomes the norm in certain online communities. So we might struggle also to consider them as deviant. In any case, they are harmful. I won't linger a lot on those aspects today. Work on that in other studies, but that's more or less the key point. It's also useful for us to go beyond an element of like legal responsibility that might be lacking, but put some focus on elements of moral, but also collective or corporate responsibility. So from a criminological point of view, is an approach that can help us to think a little bit outside the box, if you want, and bring in some criminological understanding to things that are not specifically criminal or deviant. So as said, this is a part of a broader research agenda. During the pandemic, I've done several work on information pollution. Probably the key point is this book recently published. However, most of the work that I've done is mostly focused on qualitative research, digital ethnography, for instance, on interviews and things like that. So today I'm mostly focusing on the two studies that here you can see highlighted in red. Those are two studies that are waiting for a final decision. So we received some relatively minor revisions. We are just waiting for this. So fingers crossed for that. In any case, for the second one, the policy brief is already online, and the project report will be out soon. So if you want further information, I can direct you in the right direction later on. But let's start with the core of these studies. So the first one that I'm going to present is called To Wear, Not to Wear, Unpacking the No-Mask Discourses and Conversation on Twitter. This has been a project led by me, but as you can see here, we have Leslie Carr, so Web Science, involved, and Ashton Kingdon, one of my brilliant PhD students. She's a criminologist as well, with expertise on radicalization. So a little bit of background on this study. So it is really about face masks, at least in a Western context here. So in the context of the current COVID-19 health crisis, wearing a face mask in certain countries, definitely in Italy, when I'm based in this moment for my sabbatical, but we have all read in the news about like the US, etc., has become a hot topic, with some local and national governments giving discordant advices, some citizens wearing them willingly, while others have staged protests opposing mask mandates. Some political groups have exploited the situation, backing the politicization of masks as a way to minimize the impact of the pandemic in the effort to preserve the economy and please a part of the electorate, or as a pushback against what they view as the government overreach. Problematically, at least in my view, in this scenario, health-related misinformation has been spread to back up what are mainly political considerations. Because of their features and algorithmic architecture, social media, of course, have been having a major role in this context, facilitating the promotion of political agendas through the dissemination of medical misinformation and enabling the capitalization of the political narrative, linking the discontent caused by socioeconomic impacts of the pandemic to specific political ideologies. So in many Western countries, the rise of a no-mask or anti-mask movement has been reported, for instance, by many media. And for instance, this has been compared to the anti-vax movement as activists more and more became a vocal force in opposing what as recognized nowadays as an important preventive effort for public health. So, something more in the background about the polarization and the politicization of preventive measures. So over the last year now, we have witnessed, well, more than 1 year, we have witnessed stormy debates in many countries, opposing views pushing for more stringent preventive measures, and considering also like test and isolating approaches, the mandatory use of face masks, this was in contrast with other views promoting business as usual. The stances at the core of these debates have been at times different, of course, depending on the specific country, and they have been shifting in the course of the pandemic, also with the U-turns, depending on the changing infection rates. Overall, in any case, we can distinguish a sort of a polarized divide between more risk-prone and risk-averse groups with regards to preventive measures. And this can be identified in many countries, in many public debates, also online. This polarization, at least in the Anglosphere and in other European countries I am more familiar with, seems to be quite aligned with the diverging political views. This is a problem because the politicization of what should be factual, scientific information can be very problematic, as can lead also to long-term problems, fueling science skepticism among citizens and scientists themselves, and fostering the spread of misinformation. From a psychology of misinformation perspective, we know that partisanship affects information processing, and that information can be very persistent and difficult to erase from people's memory. People tend to perceive all partisan content news as more plausible. Some groups have been reportedly very active in spreading misinformation during the pandemic, and the fringe groups for instance, have been reported to be very active in propagating misinformation and conspiratorial thinking. This is, of course, not surprising, considering that beyond the immediate public health emergency, the global pandemic-led crisis has had profound effects on governance, social polarization, and political and ideological discourses, all of which, of course, influence a lot the ways in which certain beliefs are being packaged and disseminated. The outbreak of the coronavirus pandemic has generated an upsurge in public debate and information regarding the origins, nature, and potential impact of the virus. With global lockdown measures constraining millions within their homes, the opportunities for extremists to use technology to radicalize, recruit, and disseminate propaganda has grown exponentially. In addition to such extremist propaganda, the pandemic has seen deliberate and concerted disinformation campaigns, which the environment of fear and chaos being exploited by some bad actors to spread, again, false information and conspiracy theories. Some of the most prominent conspiracy theories that I'm sure you have read about in the media are interviewed with the so-called QAnon phenomenon. QAnon is a predominantly America-based conspiracy theory that progressed into a movement spreading to dozens of countries worldwide. It represents the first born digital meta conspiracy theory, representing a militant and anti-establishment ideology rooted in an apocalyptic desire to destroy the existing corrupt world. And its growth through the influence of social media and the effects of the pandemic has been considered unprecedented by other authors. So in the pandemic context, to sum a little bit up this background, And through polarized online discussions, also with the intervention of some of these extremist or conspiratorial thinking groups, for some, the face mask became a symbol through which people can create, use, and distribute a certain social identity, coming to represent who we believe we are and how we want the others to see us. So in our work, we started from this background information, and we decided that it was quite interesting from a social criminological perspective, and we wanted to unpack this further. So our approach. The study, as said before, has been carried out in a very collaborative way by researchers in the social, criminology, and computer science. The socio-technical approach adopted promoted a constant interaction between the computer scientist managing the data collection and network analysis, and the social scientist providing subject matter expertise. And we think this enabled us to observe both general trends, but also to zoom in and analyze more closely some more in-depth, some subsets of data that we deem to be of particular relevance. Tweets where we looked at Twitter data, and tweets were collected for a 5-month period from the very beginning of February 2020 to the end of June 2020. The collection was timed to start just before the adoption of the hashtag no masks in the context of the pandemic. Previously, the hashtag was used, but in the context of the Hong Kong protest. But from the pandemic onwards, basically started because of a time shift, it started to be used for the face masks. Tweets were collected if they included any of 4 key hashtags that we identified after some preliminary manual searches that have to deal with no mask, no masks, anti-mask, anti-masks, things like that. So we did a preliminary manual analysis to identify the best hashtags to use, and then we started collecting our data. This search produced a total of, well, more than 23,000 tweets with, of course, we were able then to, how to say, snowball hashtags, and we got a total of almost 10,000 hashtags, as you can see the slides, from a total of almost 11,000 Twitter accounts over the 5 months considered. Here, it's important to stress that our decision in this specific study to use hashtag to sample our data was because we really wanted to identify those tweets and those accounts that in a very deliberate and explicit way were trying to align and to enter into debates with the public discourses on Twitter on our topic of interest. So the fact that they were choosing to use certain hashtags, in our view, was suggesting that they were really trying to align themselves with those views. We were interested in those type of population. Well, of course, it goes without saying that relying on Twitter data has several limitations, especially as regards potential demographic biases, issues of social media access, and the unknown provenance of some data. And of course, relevant conversations are online, are played out in way more social platforms than Twitter, and not only online. Nonetheless, we think that Twitter still allowed us, despite its limitations, to examine some aspects of interest of this wider conversational engagement. So here we have 2 stages of analysis. So just checking the time. Okay, so 2 stages of analysis. The first one was quite qualitative, based on some judgmental sampling that was aimed to explore the most prominent themes associated with the no mask discourses, and focus on the more used hashtags and tweets that elicited the biggest response from other Twitter users in terms of likes, retweets, and response. So out of our total hashtag populations, only about, let me check the numbers here, so 2,849, so a bit less than 3,000 3,000 hashtags were used more than once, less than 500 more than 10. Among those, only 45 were used more than 100 times. So we created a small data set of hashtags with these 45 that were the only ones that actually were used a lot, meaning that all the other hashtags were quite dispersed and not liked, retweeted, or used much. So we were basically people shouting in the void without really engaging with other parts of the conversation. Out of the total, so moving from the hashtag to the tweets, out of our total population of tweets, which is again more than 23,000, only, which is quite interesting, I think that only 149 tweets received more than 100 likes and only 79 more than 100 retweets. So by joining the selections, there were duplicates, and at the end we found 152 tweets with the unique value, which we defined as the most popular tweets. So as you can see, it was very easy to refine the large data sets into very small data sets, basically suggesting that the big majority was really people like shouting in the void with no one caring about those tweets or retweeting them. We were also interested in looking at the tweets with prompt more conversations and not just likes. And this, of course, could be operationalized by looking at the numbers of replies. And again, this is quite interesting that out of the full data sets of tweets, only a little bit more than 4,500 received at least one reply. The others, no reply at all. We decided to define as successful in prompting a conversation the tweets that received more than 50 replies, so those that actually engage a sort of like large scale conversation. And here we obtain a subset of 45 tweets, which got a range from 50 to a maximum of 618 replies each. When comparing the data sets of the popular tweets with the successful tweets in prompting a conversation, again, there were a lot of duplicates. So there were some tweets that were simply like more successful, broadly speaking, than others. So basically, considering all the major overlaps with this kind of small, let's say, successful or popular data sets that we build, we decided to consider them all together for some in-depth qualitative analysis. And once we took out the duplicates, we found the data sets with 155 unique tweets sent by a total of 108 unique accounts. And all data from these two subsets were thematically analyzed manually, meaning that we were able then to look a little bit more in detail what was there, what was sent in there, the content, if there were links, visual elements, and things like that. So the second stage of analysis, which you will see in the next slides, focused on the conversations, so looking at the interaction between the accounts that appeared in our full data sets according to our criteria. We defined a complete mention network that was composed of everyone who tweeted who was mentioned in one of those tweets, even if they didn't tweet using one of the hashtags that we were considering. So the very broader network that you could identify. The basic tweet network comprising all those who in an active way contributed to one or more tweets in our data sets. Then an internal conversational network comprising accounts in the basic Twitter network who mentioned each other or replied to each other tweets. And again, it's a very small one or very active, if you want, users, 144. And the successful tweet network comprising those who contributed one or more tweets that passed the threshold of significance response that we set before. And again, only 108 tweet were able to enter this kind of small club. So before moving to the social network part, just some notes from the stage 1 part of the analysis, so the more qualitative part. So by looking qualitatively at the most popular hashtags and tweets, we were able to examine in much detail the main themes that were receiving attention in the Twitter sphere in association with the no mask discourses. Again, all the others was basically shouting in the void. So those were the themes that were receiving attention from like distant numbers. So first of all, we manually sort out the 45 hashtags, checking the content, of course, manually to clarify, you know, what they meant with certain hashtags, etc. And in this first stage of analysis, already we started noticing something. So for instance, we immediately confirmed the presence of QAnon promoters and other politically oriented movements in the dominant anti-mask discourses, together with, for instance, anti-lockdown supporters and anti-vaxxers. And it made immediately clear to us that the discourses were all predominantly US focused, American focused. We found let's say a presence of other countries. We'll discuss this in a second, but the big bulk was definitely US focused. We need to also to consider that this was a little bit like a pre-American election. So of course there was a lot of political debates going on in that area. And second, we looked at the subset of the 155 most popular and successful tweets. So looking at the tweets and not at the hashtags. And also in this case, we categorized the tweets into thematic categories depending on the main focus of their content. It's just summarized here. Of course, you know, the total numbers is higher of the number of tweets we consider because some tweets were in more than one category. First of all, this category is immediately clarified us that we should not consider a no mask movement, that there is no such a thing as a unique movement here. Rather, we have several different heterogeneous actors, some acting in their individual capacity, others as part of a specific movement or organization that in a very independent way were pushing a certain narrative in line with their own personal system of beliefs or to promote or sustain a certain political agenda. For instance, it clearly emerged how, at least in the US, the coronavirus pandemic has supplied a very fertile ground for anti-government movements, radical right groups, and conspiracy theories who have somehow joined forces in anti-containment protests about the nation. And of course, here I'm just focusing on this study, but I found quite intriguing that the very, very similar results were found as regards the Italian cases analyzed through virtual ethnography. So even by looking at a slightly different, like geographical, of course, focus and with a completely different methodology, the lack of a unique movement and the presence of this like let's say parallel and diverse teams that still are converging versus something. I will discuss this more in detail in a second. In both cases, we're really explaining a lot of what was going on online, in my view. So going back to this kind of summarizing tables, the themes raised by these various voices and actors, of course, are quite diverse, ranging from election policies, politics to social controls, from conspiratorial thinking to some issues of race. There were references to, for instance, to Black Lives Matter, etc. There is, however, as I said before, a transversal theme that is at the very basis of putting together under the same hashtag umbrella, if you want, some very diverse groups in a logic of us versus them, which is the logic of freedom versus tyranny, tyranny of the government, the so-called deep state, tyranny of the official scientific experts, tyranny of the World Health Organization, depending on the tweets. So masks, similarly to lockdowns, are seen by all the actors that were tweeting this stuff as an undue interference impacting individual and group liberties. Official health recommendations are in these tweets disregarded or even challenged. Seeking strength in numbers, individuals moving under the no mask umbrella, even if they are not part of a movement, are still trying to look for allies, if you want. And they are all trying to reestablish a sense of control after having experienced a loss of agency during the pandemic crisis. So in this context, different movements, even very different among themselves, embracing this umbrella in a way can exploit the situation to present themselves to others as sympathetic allies. And this, in my view, is really the key element at the core of the success of information pollution during the pandemic and also before the pandemic. You are engaging by presenting yourself as a sympathetic ally, even if you come from a different, let's say, group ideology, etc., you can still like reach to many others, as you will see in a second, because you're presenting this, let's say, narratives that are converging with the system of beliefs and values of other groups. So, from this first stage of analysis, however, it also emerged that the voices of the pro-masks opponents that were directly trying to engage online on Twitter in the prevalent anti-mask discourses were extremely limited, and hence the discourses, the different discourses that they were trying to promote always ended up being completely outnumbered. So in other words, pro-mask discourses, or at least how they are pushed through Twitter, especially through the use of hashtags, end up being very marginal in the overall anti-mask context. And it's also relevant to note that the tweets associated with the prominent pro-mask hashtags were clearly not looking for genuine dialogue with their counterparts. They were openly antagonistic. And from a science communication perspective, this was really worsening the polarization of the debates and really not helping engaging in a constructive conversation. Just something quickly on the interaction between accounts. So here, we initially investigated the use of hashtags under consideration in a large collection of tweets by looking both at the complete mention network and at our basic tweet network, so the one with the 10,000 something hashtags, by scrutinizing the users who wrote those tweets and the relationship between them to determine whether there was an obviously coordinated activity, for instance, whether there were some clear relationships among between the users, whether they were communicating with each other, whether they were at least aware of each other's existence. So basically, also we did it from a very small data set, from a very in-depth qualitative insights before, but then we wanted to try to determine this also by looking at big numbers with the social network analysis tool. So our results once more show that although the tweeters were heterogeneous actors independently pushing diverse but converging and compatible discourses, in line with our thematic analysis just presented, only a very small number of them, just 124 out of more than almost 11,000 accounts, actually were exchanging tweets, hence demonstrating a little overall engagement with each other. And again, you can see here how these three circles, I mean, they're completely, I mean, the majority of people is like literally, like if you see like the outer circle here, shouting in the void, which is quite telling, but still they were raising themes that for us could be of interest. Then we turned our attention to the successful tweet networks, comprising those who contributed one or more tweets that passed the thresholds of the significant responses. Here we had 108 tweets. So a closer analysis of the tweeters confirmed again that the discussion was heavily US-led, apart from a few users from Italy, one from Pakistan, one from India, one from Ireland, one from the UK, one from Germany, but the predominantly was really US based during those early months of 2020. 7 users explicitly described themselves as QAnon followers, 29 as Trump supporters, 10 as conservative Christians, being part of traditional families, pro-life, free thinkers, patriots, NRA supporters were other of the recurrent themes in the users' descriptions. Again, we went and looked also their online profiles. Being censored by Twitters in the past was mentioned by some as a sort of badge of honor. And In an attempt to find further similarities, we looked at who the 108 successful tweeters are following, revealing once more that the top most commonly followed account was real Donald Trump, POTUS, White House, and FLOTUS. So again, this is pre-American election, and there was a very, very, very clear trend here. Interesting, being anti-European Union, or for the, let's say, for the non-American profiles, being anti-European Union or anti-Euro, pro-Brexit, or pro-Salvini, so an Italian politician known for his right-wing populistic ideas, were recurring themes for the non-US-based accounts, confirming once more than the variety of actors presenting under our initial no-mask umbrella, and yet they're being bonded by very comparable and compatible narratives. This heterogeneity of successful tweeters was to be found also by looking at their overall Twitter presence and popularity. Some of the tweeters behind the most successful tweets joined Twitter more than a decade ago, some only over the last year. Most of these tweeters, in any case, didn't have particularly high numbers of followers. Only 3 of them were close to 1 million followers, and most have, just, a few thousand on really not much. It's just that they were able to successfully engage with others by entering a certain narrative and a certain conversation. Some notes here. Well, actually before, well, it's a little bit late, so probably I can skip this part and moving to some discussion and conclusion on the study. So the study analyzed the no-mask discourses and conversation prevalent in the first stages, of course, of the pandemic in the Twitter Anglosphere by bringing together network analysis and qualitative approaches. We have shown, I think, that while there is no no-mask movement or not even a community, we can still identify a range of heterogeneous actors that under the no-mask umbrella have been independently promoting diverse but still politically compatible discourses. Overall, even if conversations occurring under the no-mask umbrella are overall limited, as tweeters using relevant hashtags are not talking to each other, they are still relatively successful in engaging with a larger audience. And this features entails that tweeters promoting anti-mask views and their converging and comparable narratives are well positioned to increasingly engage with and potentially attract users on Twitters who might be driven towards the anti-mask narrative by one of his neighboring discourses and vice versa. I think this is quite interesting because while we were doing this study, there was another study on anti-vax movements that on a completely different data set, and again on anti-vax rather than on no masks, was suggesting, if you want, like quite similar conclusions about these converging like narratives. So probably it's something that is, all true also in other types of medical or public health, if you want, misinformation. I think that it's important to note that the lack of a structured network does not mean, of course, that algorithms do not have a key role as the enabler of misinformation or disinformation. They still shape the looser networks driving the convergent narratives that we observed. The exposure of citizens to disinformation, polluted information, and even extremist propaganda in some of the cases observed has truly become a socio-technical concern. And as we see the political engagement of some of these groups, I think that it's important to note the potential, like say, large, long-term scope of the problem, also beyond the public health emergency. And because of the truly socio-technical concern, I truly believe that a socio-technical response is needed, one that is really making the most of both the sociological and computational expertise. In our study, we have also confirmed that political drivers and QAnon conspiratorial thinking had a pivotal role in propagating potentially harmful, both for individual and public health ideas related to the use of protective masks, fostering the conception that masks are a symbol for socio-political identification. From this perspective, public health communications or online activists insisting in underlying the preventing value of mask wearing without trying to disentangling the identity construction value that protective masks now hold are definitely set for failure. So I think that there is some practical implication by unpacking a little bit the identity construction elements and the political narratives that is linked to certain, let's say, public health intervention. In our case, in the case of this study, wearing a face mask has some important implication in the field of like science communication, in terms of we need to understand like the mechanism behind, so to best intervene and dismantle them when needed. Sorry, just checking the time. So I'm definitely run out of time. So I will go just very, very quickly through the second study, and maybe there will be more time for discussion later also, because the report of the second study is coming out of free soon. So there will be like a lot of details there. So what we try to do in this second study, to up or not to up, understanding public resistance in using COVID-19 digital contact tracing, was looking basically at relatively large data sets of tweets to explore public discourses about the COVID track and trace system, the NHS app that has been used in England and Wales. Also in this case, this was very collaborative, interdisciplinary project. Why this is relevant also in this case, and how this fits my broader research agenda on information pollution and misinformation. Some of the, of course, contact tracing apps have been suggested or tried to use in many countries. In some countries, in some Western countries, they've been not much successful because they've been very scarcely used. And some of the discourses, let's say, driving their, let's say, the resistance towards the use were imbued with health-related misinformation and other types of health polluted information. In our case, this was particularly important in our view from a social criminological perspective, because at the end of the day, this is about resistance to official technologies. And there are a lot of criminological studies of surveillance tech, but generally they focus on coercive systems such as electronic monitoring device. And from a criminological perspective, for us, this was interesting because it's resistance on a tech that is adopted on a voluntary basis in most Western countries. So that was why this was like of our interest. So here I definitely don't have, sorry, I need to go on with the slide. Yeah, I definitely don't have time to focus on the detail, just to show you that also in this case, we use a computational part of the analysis, again, through social media analysis to look at the full data sets that we got. So in this case, it was about 55,000 tweets from March to December 2020 for a total of almost 40,000 accounts. Also here, we try basically to unpack this big network into, well, you can easily identify 3 different circles or parts there. And then in this case, we look with much more detail. Well, we sampled, if you want, some parts of each of those to understand a little bit what type of conversations were going on there, what type of users were there. And actually, we observed some differences between the conversation occurring at the outer end. So people very angry, basically shouting in the void, people here that were engaging in like more community networks, discussing, for instance, some socioeconomic issues and challenges that we were facing and things like that. And people at the core that we looked more in detail, that, as you can see, are much more engaged. We also use other types of computation, if you want, tool for qualitative analysis, such as keywords in context, etc. So basically, we had a lot of data that we try to analyze, again, from a qualitative point of view. We created basically a sort of a qualitative concept map out of this computational data, trying to identify some frames and mechanisms of resistance. So in terms of frames, basically a lot had to deal with lack of trust, the presence of negative liberties, and in terms of mechanisms, again, polluted information, conspiratorial thinking, and reactance, which is basically psychological mechanism showing that people tend to be averse to having restricted freedom or ability to act in a particular way were really key to explain the dynamics across the networks. Because of time constraint, I will skip a lot here and rather conclude in a couple of minutes, which I think I still have, right? I should have a couple of minutes now, okay? Just with some concluding notes of some of the, let's say, commonalities and things that we can learn, I think, from these studies as a whole. So first, the context of interdisciplinarity or cross-disciplinarity at least. These studies, at least the two that I presented here, so let's say one very, very quickly, further a sociological approach to pandemics, focusing on some sociocultural processes enabling and sustaining the propagation of potentially harmful mis or disinformation during the current coronavirus pandemic. As said at the very beginning, the topics of polluted information and medical misinformation are not traditional or mainstream criminological ones. However, I think I've argued how colleagues from the social sciences and also specifically criminologists should consider them within their academic jurisdiction in light of some of the social harms these behaviors allow, even if this means stretching and looking beyond some strict disciplinary boundaries. And most importantly, for the context of this webinar, I think that it's important to stress that both the studies I referred to in this presentation have something, of course, in common, apart from the fact that they have to deal with certain effects of information pollution. They all have to do with socio-technical systems, in premise social media. And as such, as I said before, a socio-technical response is needed, and socio-technical methodologies can really help us in this context, which again, I think it's about using a lot of computational tools to make sense and to navigate and to survive the big amount of data that we are facing, but without forgetting the need to look and dig further into some parts of these with some qualitative tools. I'm very keen to stress that large data sets are not just large quantitative or computational data sets, they're also like large data sets of qualitative data, and more it's about finding ways to deal with qualitative data also in large data sets context. Then we're dealing with, of course, complex phenomena. Here, there are social harms involved. In this presentation, we didn't focus a lot on the social harm aspects because, again, there are time constraints. But, of course, all the result at the end of this polluted information, at the end of this resistance to public health policies, at the end of some other extreme types of misinformation that sometimes I've encountered in these conversations, like, I don't know, drink bleach to treat the coronavirus, like all type of like weird information that you can find in some of these networks. You might have, it can be sometimes a matter of life or death. It's a matter of health. You have primary victims, the individuals affected, you have secondary victims, you have like their, I don't know, network of family members, friends, close community. You can have also like tertiary victims at the like public and level, because if you have like a lot of resistance to public health intervention, then the public is of course affected because they don't work as they should work. So there are big social harms involved, but of course there is not a magic bullet because of the complexity of the phenomena. And again, there is from the literature on online social harm, we know that there is no single best strategy for the control of prevention of this phenomena and of polluted information. So in order for proper immunization and healing to occur, we definitely need a sustained, concerted and multi-layered effort between a range of institutions, individual actors, and the technology sector. This is of course a very challenging task, but as the pandemic has shown us, that's something that really cannot evade. And again, there can be some long-term social consequences for how some of these online discourses were probably not dealt with in a more appropriate way during this pandemic. And that's all from my side. And I was like a few minutes late. Sorry for that. but almost there. I stopped sharing my screen.
Many thanks to Professor Lavorgna's really inspiring and thought-provoking presentation. And now I would like to use 2 minutes to briefly introduce our discussant, Professor Wei Ran. Professor Wei is the principal coordinator for a project that is a miscommunication, trust and information environment, a comparative study of the COVID-19 infodemics in 4 Chinese societies. And this is the team led by Professor Wei. And as we can see that the project aims to take a holistic approach to examine the emergence and spread of false and misleading information about the pandemic on digital media in 4 Chinese societies. That is mainland China, Hong Kong, Singapore, and Taiwan. And the project combines big data analytics with some social scientific research methods such as surveys and focus group to explore, clarify, and theorize the dynamics of infodemic diffusions during the COVID-19 pandemic. And Professor Wei's research basically covers media effects and perceptions and cognitive biases. And also we have another discussant that is Professor Liang Hai. His research area and interest is on computational social science and social media and analytics. And with a lot of commonalities shared with Professor Lavorgna, some research, we really look forward to the comments shared by Professor Wei, and then Professor Liang Hai will join us in the section of Q&A session. So the floor is yours, Professor Wei.
Right. Thank you very much, Professor Huang, for your generous introduction. I would like also to thank Professor Tony Tan for inviting us to be part of this webinar today. And as Professor Huang mentioned that the team that I'm leading right now to working on something similar to the project the Professor Lavorgna has just presented. So I will just use my 5 minutes by sharing what I have learned from this exciting and informative presentation. And then I would like to share my questions about the problem in front of us. What can we do as social scientists? Okay. First of all, I would like to say I enjoyed the professor's informative presentation, and a really a good topic that of global concern, in which I think if I get something right out of these 2 studies, that the misinformation about wearing a mask, also the social tracking apps, really a window into the reflecting the problem of social problems we have in different parts of the world. Each country and society has these problems. The pandemic just provide the context or the kind of mix to make the problem even worse. So my impression or what I've learned from this talk is that by exposure, engage with the disinformation, misinformation, our society is even more divided. But unfortunately, fighting the pandemic requires the collective action. It affects everybody. It's not just me, the exception. Nobody is exception because of the virus knows nobody as such. So I think this talk is very very informative in that disinformation really harms society in different ways, that we're divided by other issues. Like in the US, Black Lives Matters was a major social movement that was in the making, and also have millions of people marching across the country. And under the pandemic situation, are we closer on those social issues? Unfortunately not. Some politically motivated groups like Professor Lavorgna has mentioned, that they use the opportunity to diffuse, create, and spread disinformation and misinformation about this pandemic for the political gains and political means. So I also like this study that is a collaborative type of research that with interdisciplinary approach, calling on the expertise of computer science, social science, sociologists, in which we look at different pieces of the puzzle, trying to figure out the mechanism, the process of social harm that was being introduced by this information. So this means a lot to my team as well. We're doing something similar, and I can say that with big data scientists, analytics on the board give us a different approach, a different perspective to make sense of things. On the other hand, traditional social science research also brings up the kind of thought process, cognitive mechanism to understand the bigger patterns of messages and diffusion and communication of these messages. And I think that in this study, if I would like to hear more, is that what are the other types of social harms that beyond the social division? That's a big harm itself that we have to face and address. I think in our own research, collecting data from the 4 Asian societies, we found that the social harms can also mean acceptance of false beliefs that's propagated in those misinformations. Also the kind of negative emotions, anxiety, and it creates the kind of irrational responses to process information rationally. Okay, also anti-vaccine attitude or even inaction against vaccination. So the social harms are much broader in my sense beyond the division. Division may be the reason, maybe a result of this disinformation communication process. So my question for Professor Lavorgna is, what do you see the solution facing the kind of social harms we see in these 2 empirical studies? What are your thoughts on the social science solution to at least reduce the harms, control the harms, eventually to solve the problem created by misinformation?
Should I take this question
Yeah.
now? Okay, so yeah, first of all, in terms of thank you so much for your comments. As regards the social harms, I absolutely agree with you. They're much broader. Again, for the sake of the argument, I just focused on some, but it could be like another couple of hours just discussing the social harms. Definitely, it's about some physical harms, and again, it depends on. It's about. I can tell you a little bit more about some of the conversations that we looked more closely, that I couldn't, encompass everything in a few slides, but from people taking, let's say, unneeded drugs or potentially dangerous substances in the attempt to prevent or cure the virus, or people refusing to be treated and then end up delaying the medical response after a point where it could be very dangerous, in the meantime very highly infectious for others. So there can definitely be some very big physical harms. Definitely is a matter of sometimes also emotional and psychological harms. It's really about, as you mentioned before, this climate of anxiety, and some of these people are really most of these people really trying to look for information online. They don't know what to believe, who to believe, and that of course leads to some strain and anxiety. There are definitely monetary harms, meaning that there are some fraudsters also in these groups that are preying on vulnerable victims, rather than having a free vaccination or a relatively, in most country, not too expensive masks, etc. They rather sell some very expensive treatment with no scientific plausibility, for instance, or some side things. So there are societal harms in terms of the social trust that is eroded by this type of discourses. So again, there is a very broad range there. As regards the role of the social sciences, well, I mean, first of all, it's about, I think that the most important role here is really unpacking the problem and debunking some of the ideas about this problem, so that better interventions can be thought, at least. As I said before, I don't think there is a magic bullet. I don't think that there is like one way of intervention, but I think that there have been mistakes that have worsened the situation, and probably we need like to know better, so to avoid these mistakes in the future, because it's likely that like other public health crises will happen. Hopefully not, but we need to be better prepared for, of course. So I can bring you some examples that have to deal with the US or British like scenario as analyzed in some of these data sets, but also from my qualitative like virtual ethnography and other studies, mostly focused on Italy and the UK. And there is something that is kind of a common themes emerging through these studies, is how bad communication from also traditional media was. Because of course here we're discussing a lot about social media, but actually social media was then like giving rise and giving a lot of evidence and clustering people together, but actually main form of information for a lot of these people was like more traditional forms of media, or maybe how then traditional form of media were then reposted and spread through social media. And in all the countries that observed, most media have been, traditional media, have been absolutely like terrible, fostering confusion, because of course, like with very bad headlines and things like that, and the people that have no, I don't know, like ability to distinguish, what is true and what is not. They're just like reading headlines and things like that. That's definitely been like something that really created a lot of problems. It's definitely a problem of education, of lack of, let's say, scientific literacy from people, so that things that were completely absurd from a, like first class of biology, if you want, type of point of view, were absolutely believed as potentially of relevance and pseudo-scientific in a way. So that lack of like basic, scientific literacy and like critical thinking was definitely a big problem there. So there is definitely a problem of education, a problem of like social media literacy in understanding like, some basic mechanisms behind. And, it's quite difficult to discuss these issues with people, like, you should not really trust, what has been reposted there, when people are so, I don't know, in a moment of heat where people are already like highly polarized, etc. You should be prepared to this type of things, engaging with awareness raising, campaign, education campaigns, etc. in moments of calm, so that you are ready when the problem emerges. And I think that in all these issues, social sciences definitely have a role, which is really about understanding and unpacking the details of what went wrong, if you want, and
Yes.
to think for the future.
Yeah, it makes good sense. I agree with you on the approach to do a better job increasing the literacy about social media, also about information literacy as well. How about the aspect of rebuilding social trust? A lot of people are complaining we are living in a time of weakened public institutions. Like back to your model, you mentioned the lack of a trust as a major mechanism in which a lot of the problems or harms were done. In our own research, we found in the Asian societies and Asian perspective, trust in government makes a big difference. People who are late in taking vaccination, or people who refuse to be vaccinated, or those with very low level of trust in government. Okay. On the other hand, if we are looking for solutions to control misinformation, those who trust government at very high level tend to support the government's role in controlling, regulating misinformation. So probably we have also to look at not just the technical educational aspect, also thinking about ways to rebuild social trust in institutions, trust in the public good, things like that. I'll leave my time for my colleague, Dr. Liang Hai, to talk about the big data aspect. Like I want to know the visual visualization of your result of network, the kind of colors is not clear to me. Which color reflects what? I will give the time to my colleague Liang Hai to ask those big data questions.
Yeah, if I may, okay, can I cut in just like 30 seconds? So for the audience, if you have any questions, please feel free to use the chat box to leave your comments or questions so that can facilitate our discussions later. And now, yes, the floor is yours, Liang Hai.
Okay, thank you very much. Actually, I learned a lot from the presentation, very good presentation. Thank you very much. So I just want to focus on one very important thing. Actually, for me, I learned so many things in such a short presentation. So in particular, actually, I personally, I like the protection, the concept of information pollution, and also the way that you conceptualize the concept as a social harm. It's really, actually, that in the last few years, that there are a lot of studies about misinformation, disinformation, but I guess in particular for empirical studies, usually the scholars focused on describe the situations, the pervasiveness, and also we just discussed that a lot of experimental studies and what to experiment how to correct the situation, but generally we don't put much attention on how that the misinformation or the spreading of information influence our society at whole, not just personally. But the problem is also, okay, my question actually is quite similar to Professor Weiss, but I want to add one more that about the computational methods. We know that actually it's good to use a computation method to describe this the problems, like using Twitter data, even using other digital trace data that to describe the situation. Also, even there are studies that to estimate the pervasiveness, but the results actually sometimes are very controversial. Some studies think that actually basically the volume is high, but actually the proportion actually is relatively low. But again, about computational methods, but the problem is that it's very hard, unlike experimental survey studies, to test the effects. So it's a pretty. I think this is quite challenging, but I want to know your opinions or your plans in this area. Thank you.
Yeah, well, thanks for the comments and the questions. So I think that it's always important to remember the limitations of the data that we are using. I don't know if this reflects if I got your question right. So when we are using Twitter data, and I briefly mentioned that before, of course, we are using something that is very specific. We are looking at a specific part of the population. We are looking at people that are, not everyone is on the type of social media. You are looking at social demographic characteristics. People can use Twitter in different ways, in a more active ways, or just scrolling the screen, etc. So we are not really observing reality. You're not observing the general population. You're observing a part of the conversation. Still, it can be a very convenient and cost-effective way to feel the pulse of a certain situation. So I think that this type of tools or computational tools can still have their value if we are very careful about their limitations and not to overgeneralize findings, for instance, in that. And that's also why I think it's very important to look at them from different perspective, precisely to avoid to try to go for bias minimizations in that. So when you're deciding what type of data you want to gather, in what type of ways you want to analyze that, double checking a little bit with the a little bit of manual analysis and things like that, to make sure that you are looking at something of relevance and you're not going in a completely different directions because maybe the certain keyword or hashtag or something was used in a completely completely different context or things like that. So for instance, in our data gathering, there were a lot of like this manual checks to make sure that, you know, we were not like going out of track with data collection, which of course makes things, you know, slightly more slow. It's not just, okay, this is the no mask and that's all, let's collect everything, but at least we think that in this way we can at least minimize biases. And of course, in this type of data sets, there are always some, you know, false positives or false negatives, but we try to keep them as small as possible. I'm not really sure that I answer your question with that, or did I? Okay.
Yeah. Thank you.
Okay, good. Thank you very much. I think we have several questions here in the chat box. So Professor Jumbo leave quite a few very good questions. If I may, I would you know let me just let me see. Or Professor Zhang, do you want to, you know, just elaborate your questions, or maybe I would just read the questions for you. Okay, so Professor Zhang, or okay, I will just read the questions. Okay, the questions here is that, okay, in 5 tweets related to the anti-mask conversation, your team crawled from February to June 2020. It is reasonable to assume that the legal codes for the criminalization of not wearing face mask differ across countries and across time. Would you mind elaborating on the strategies you adopted to ensure that the crime harm as a result of not wearing face coverage? Okay, covering is consistently operationalized across countries and consistently measured over time. And were there any few Twitter's accounts that generate a high percentage of crime harm in the anti-mask conversation?
Okay, well, this is I can answer this quite quickly, hopefully. So in terms of things changing over countries and over time, yes, absolutely. And that I'm pretty sure that conversation, you know, we looked at this kind of like snapshot in time in our analysis. If we look at you know, the same 5 months, 1 year later, the types of conversation will be, of course, like different. In our case, just to make a reference to the first case study presented, it was something that was like closely related to a sort of like pre-American election, and there were a lot of debates in that you know, in that how to say area. In the analysis of the NHS app in the UK, it was you know, with data that were taken in any, like say, before the summer and before the release of some of the let's say lockdown measures over the, or preventive measures over the summers. Of course, then people conversation, of course, like, I mean, I'm expecting them to change. Okay, still I think the fact that by looking at let's say snapshots of data from different studies in different moments of time in different countries, the fact that there are some similarities in there as regards the different narratives but converging themes that we mentioned before, I think that is telling, you know, that despite the difference, you can still find some common ground which points in a very clear direction. As regards the crime harms, I think that was a little bit of misunderstanding at the beginning. So when that's the fact that as criminologists we use sometimes the same word but to indicate a lot of different things depending on the theoretical perspective. So yes, harm and crime harms can be operationalized and have been operationalized, and that definitely I don't know if I want to say I am stealing this phone, what is the you know, harm, how can I operationalize the harms of stealing that phone, and that is something. And of course course, we can think about applying a similar model to the social harms created by the pandemic, but that is not what we have done. When I was referring to social harms, it's more about the, if you want, theoretical approach that that I took to show how these practices that, again, you know, information pollution during a pandemic is not the first thing that comes to your mind when you think about a criminologist, but just to show how I think they are deeply they are deep concern also for criminologists, because still they produce social harms. But this was not something that we operationalized or try to measure in this project. That will be a very interesting project, but that will be a different project maybe for the future, but it's not something that we did here.
Okay, thank you. And one more questions from Professor Zhang. Okay, so also it would be very interesting to examine in what way were the network patterns of high volume, low harm Twitter accounts similar or different from lows or low volume, high harm. Okay, and thank you very much for your fascinating talk again. Okay, so yeah, can you answer that question?
Yes, I'm just like trying to follow them in the chat. Oh, thank you for the questions, Dora. I think that is just like a lot of like food for thought for like new research in the future here. Meaning that, again, it's linked to the question before. Again, we didn't try to measure or operationalize harm. We just like from the, let's say, by taking together the different research and from previous research done, and you know, we know that there is harm, we can like see that socially, but in this project we didn't try to measure that. But I fully agree that it will be quite interesting to do a sort of like a comparison, if you want, also because, you know, of course it's a very big umbrella term when we discuss about information pollution, and in the examples that I provided today, of course, we discuss very different types of information pollution. One is about attack resistance, one is about the use of a like face cover, and there are like many more that were analyzed in other studies, and it will be very interesting for the future, because it's true that some of them might be more, if you want, high volume, low harm, like probably not wearing a face mask. Some of these might be maybe low volume, high harm, like drinking bleach to cure the coronavirus, okay? And that type of comparison will be of extreme interest, I think, but it's not something that we did just because we looked at this different type of dangerous or harmful activities and behaviors in different projects with different data sets that are not like immediately comparable. So we didn't, but it would be nice to replicate one of those to be able to do a nice comparison among these different behaviors and activities. So thanks for the nice suggestion.
Absolutely.
Thank you, and very much I appreciate your your comments. Thank you so much.
Okay, thank you. And we have a very good question from Professor Huang Bo. I can imagine the contagion effect, okay, would be very strong in fake news propagation. Did you look particular into this problem? What effects, and do they trust or just follow the flow?
That's an amazing question, and we I mean, I looked at that, but not on I need to make a reference to another study here, meaning that we didn't look at this specifically in the study that I presented, but I did look at something similar, if you want, in another one of the project that was qualitative only. That's why I'm not presented here today. And more than contagion, for the virtual ethnography plus interviews, so very, let's say, traditional qualitative social sciences methodology that I did on the Italian online communities, basically propagating all types of harmful health information or potentially harmful counter information during the pandemic. I adopted a social learning approach that, more than the contagion, if you want, really try to shed some light on the mechanisms through which at the micro and also at the meso level, so both at the individual level and at the, let's say, online community level, they were that were used to, let's say, to, well, Yeah, we can discuss about a contagious, basically to transmit and to propagate. And at the core of the success of this is this information is just that rather than using a contagion type of like metaphor, I've used the social learning theories type of language in my work. So it's something that we definitely, I mean, I looked at it, but in another project. There are different, let's say, mechanisms and things that affect here. If I had just to stress one, when it comes to online groups, that is something that it's probably just tangential to some of the things observed in the mask project, is about identity formation. So individual and group identity formation, and how this some of these individual basically want to believe or engage a lot in certain propagation, retweeting, creating new material, creating new content, and being also sometimes very proactive in propagating misinformation through a mechanism of basically trying to define their sense of self and their sense of belonging to certain communities with a restorative sense. Simplifying a bit, many of these people are people who suffer some sort of relative deprivation, if you want to speak it in, again, in socio-criminological terms, and they're trying to make sense of a time of crisis and restoring a sense, a lost sense of self and of agency by engaging in conversations that can lead to dangerous or harmful outcomes when it comes to health.
Okay, thanks. We have another question from Sarah. Thanks for the inspiring talk. Okay, I'm wondering whether your data analysis could provide solid evidence to support the link between political polarization and anti-mask, except, okay, especially in the United States.
Well, thanks for the question. I think that in the United States, that kind of link was kind of like clear, meaning that, you know, both from the social network analysis, also by looking at not just at the type of conversations that were observed there, but also the people that were I probably just mentioned very quickly that before, but the people that were prompting the more successful conversation, if then we did a sort of like test and trying to look at who these people were following, in what other types of conversation they were engaging, and you know, the kind of like pro-Trump or you know, anti-governmental in certain like fringe groups. So there was a clear like patterns that we could identify there, and was perfectly in line with the preliminary observations we did through the qualitative analysis. So in the US, I think that at least in that stage that we observed, you know, this type of patterns were kind of clear. I think that it's it will be interesting to, let's say, to extend some of this analysis to other countries and other contexts with other keywords and with other, you know, just trying to look at different scenarios to see to what extent that is all true in other contexts. There is definitely some from the analysis observed, you know, the British app analysis, the Italian qualitative analysis carried out. Again, you can see, but it's more, it was not the focus of the analysis, but you can still have, you know, I definitely bumped into a lot of data suggesting that this type of polarization and exploitation of narratives was present also in other countries, but definitely more in-depth focused analysis on that will be needed. But I think that there is room to think that it will be very likely to observe something similar also in other Western countries.
Thank you so very much. Before we conclude our seminar, I would like to alert that there are several comments from the Computational Social Science Laboratory here. So please read the information about the PhD fellowship scheme. And so actually, I would like to take advantage of the role of the moderator to ask one more question. Okay, one last question. I really, I think the research sharing here is really fascinating. And I would like to ask, the question is that, since you have been conducting research on the organized crime for a long time, so I'm wondering, what would be the major differences, or the things that you can observe when you utilize some COVID-19 information pollution as a topic, in contrast to the previous issues that you examined. Okay, so what would be, the major differences in terms of, especially in terms of is there any a theoretical advancement or methodological challenging, when you do such very interesting studies? Yes.
Yeah, thanks for the question. Well, of course, we are dealing about very different things. I think that the big difference is that I know when you are discussing about organized crime or other forms of serious crime, you're really limiting yourself to the more legalistic approach, right? I mean, there is something that has clearly breaking a law, and so it can be about a group that is doing something that is clearly against a specific law. I think that the big theoretical and hence methodological challenge with the issues such as information pollution is that a lot of the things that we are observing are not criminal, and probably they should not be criminalized. I mean, probably that is not the outcome that we want, because you risk really to touch a lot of very sensitive issues about freedom of expression or things like that. So it's not about I want to make everything illegal. It's about it's very complex. Some of the more extreme things observed might have some elements of illegality. So for instance, yes, it's possible to observe some cases of frauds, some elements of medical malpractice. So there are these kind of cases, but the rest is much more complex, because about people sometimes in good faith sharing dangerous information. From a criminological perspective, is quite interesting, because some of the supporters of this information, some of the people that actually are there and are very proactive in creating content, creating new videos, creating pages online to further spread this information. Sometimes they are victims themselves, they are the first victims of this information, and sometimes they had some health, psychological, financial harms out of this. So they are both victims and perpetrators, if you want to discuss in criminological terms. And those are this opens up a big plethora of interesting theoretical challenges. So I think that is more complex, but I think that is the big challenge with a lot of cyber crimes and cyber harms. So it's really about you have to deal with a large corpus of behaviors and activities that in their if it's just one individual, you can think about an act of weirdness, but when on a big large scale, it can have some very dangerous implications. And given that you cannot, or maybe you don't want to act with the might of the criminal law, what can you do? And then it's really about education, technical ways, bringing together a lot of different layers in consultation to try to act together for something that is not a problem that is going to disappear anytime soon, I'm afraid. So I hope this answered to your question.
Yes. Thank you very much. The ongoing global pandemic underscores the importance of this topic. Once again, I really want to express our heartfelt gratitude to our excellent speakers, Professor Anita. Okay, I can call her first name. Also, thanks to thanks goes to Professor Wei and Professor Liang's discussion, and also thank you very much for the computational social science labs organizing such a very, very wonderful presentation and seminar for us. And thank you all for coming. I think I will conclude the seminar here. Wish you all the best and have a good evening. Okay, bye.
Thank you.
Thank you all.
Thank you.
Bye. Thanks.
Thanks much. Bye bye.
Bye bye. Thank you.